him 100% and maybe protect us 90%? That's only one question.
No, I understand. And I understand, and I thank you for the spirit of your question. I understand exactly the way you received it, and I would receive it that way. I think what he meant, and he didn't say it, but I think what he meant was they were Capitol Police, they're not regular police, and their job was to protect the Congress people. But you're right, law enforcement is supposed to protect everybody, and they're supposed to have protected the danger than anyone, whether it was other officers, whether it was civilians walking by, whether it was congressmen. So I think that you are correct in your conclusion. I just don't think that's what he meant, but he didn't say it that way, so you are correct to say that. Let me ask you this, Jennifer. I'm going back to the phones. We have callers. But there are a lot of things that are happening under the radar. 2 days ago, I spent an hour with Senator Chuck Schumer, the head of the Democrats in the U.S. Senate, along with 5 other civil rights organization heads. There's a lot of things moving in the Senate and the Congress that we're not paying attention to, like the health bill they're trying to sneak through, like other things. Give people a policy update on what's going on while we're not watching.
Okay, well, first and foremost, the president's federal budget proposal is still moving through. And as we've talked about before, that federal budget proposes to make serious cuts, significant cuts in the areas of education, housing, in the area, it actually cuts out the Minority Women and Business Agency, serious significant cuts in environmental protection. The list goes on. And of course, as it concerns health care, the bill would cut out, in partnership with the American Health Care Act that has passed at the House level and is now at the Senate, would possibly cut health care to as many as 23 million people. What we need to know right now about the health care, American Health Care Act, the proposed bill, is that the House has passed it. The Senate is working on it right now. They will not release it to the public. They actually haven't even released it to other senators. There is a group of about 13 senators that's working on this bill, and as it stands right now, it's clouded in secrecy. It's believed that they're going to uphold some of the House provisions, like cutting back on Medicaid and Medicare. It's also believed that it's going to do things like taking away the protections that were provided under the Affordable Care Act in the individual market for not charging excessive individual market premiums. They're going to supposedly try to keep some of the protections for pre-existing conditions in place. But the truth of the matter is that we don't know, because the Senate, those 13 that are working on it, have not released it. It's believed that it's actually going to move to the Congressional Budget Office, which has to, quote, score it to determine that it doesn't cost the federal government any more money to implement it. In order for them to get it passed with a simple majority of senators, 51 people, they're going to try to put it through reconciliation, through the budget process, which means that they don't need 60 senators, they only need 51 senators. So it has to be scored by the Congressional Budget Office before it can be taken to the floor for a vote by the full Senate. But what we're being told is that the Senate, those 13, are going to pass it on to the Congressional Budget Office. If the Congressional Budget Office scores it and says that there's it's not going to cost taxpayers any more money to implement it, then what we're being told is the Senate is going to push it right to the floor. There'll be no hearings, there'll be no debates on it, and if they can get a simple majority, 51 senators to approve it, then we may not know what's in that bill until it's actually passed. The Senate,
which is frightening, because it could cut back on a lot of the services that we need, including Medicaid and other things. We don't know what's in it,
Medicare, essential benefits, like prenatal supports for low-income persons who are not